many of you are calling in during breaks and lunch breaks at work, we will start the webinar promptly so that you're all able to get back to your important work as soon as possible. Firstly, I'd like to welcome all of you to today's important webinar where we will be discussing the rollout of the COVID-19 vaccine to workers in the disability sector. I'd like to start by acknowledging the traditional owners of the land on which we're calling in from. Wherever it is that we're dialing in from today, we are on Aboriginal land, always was and always will be. I'm calling in today from our Penrith office, so I'm on Darug land and I pay my respects to elders past, present and emerging. I know that Angus is calling in from our Sydney office and we'll also acknowledge country when we throw over to Angus shortly. I also want to acknowledge that it has been an incredibly challenging 18 months for all of you in your work and in your community. If there's something out there to make our work that little bit harder, we've experienced it over the last 18 months. With drought, with fires, with the global health pandemic, with the mouse plague in the Central West, and now with the floods that we're seeing across New South Wales. If you are impacted at all by the floods and you need any advice about your work or where you can access assistance, then please feel free to contact the ASU. We have been texting our members in particular flood affected areas, but you can contact the ASU office if you have any questions. You can do that by emailing help@asu.org.au or calling our office on 0293 104 000. Now, today's discussion is about the COVID-19 vaccine. A little bit of housekeeping to start. We are using a webinar function today. That's so that we can record the information and send this session on to many members who have registered for today's event but weren't able to make it, in particular because of the impact of the floods that we're seeing right across New South Wales. If you have questions, please feel free to put them in the Q&A box and we will endeavour to get through those questions during the course of today's webinar. I'll ask that you don't seek from us any particular medical health advice because we are not doctors and so we aren't able to answer those questions. We will advise you of the appropriate resource areas using the using the Federal Health Department's website. And for any personal, individual specific health advice that you may need, we encourage you to see your GP and have a conversation with your GP because they will be best placed to give you the most appropriate information. This is our second briefing on the COVID vaccine for disability services. We held our first one back in early February to share with you what we knew then about the upcoming rollout of the COVID-19 vaccine. Well, we know a lot more now. With phases 1A and 1B both underway, and those phases cover our members working in the disability sector. So today's briefing, we will cover the following areas. We'll be talking about the prioritisation of disability services and workers. We'll be talking about how the rollout will work for both phases 1A and 1B. We'll be talking about whether the vaccine can be mandatory or not. We'll be talking about how to support your clients through this process. We'll also be having some time to respond to your questions. I know that many of you have taken the time to send your questions in prior to today's webinar, so thank you very much for taking the time to do that. And we will definitely be going through each of those questions with Angus shortly. We'll also keep an eye on the Q&A box and try and speak to any other questions that may arise during the course of today's discussion. Just an important disclaimer up front, if you're just joining us, we cannot give individual health advice. We think it is important that members follow the official health advice and information of health authorities with regard to the vaccine rollout. There is official government COVID vaccine website where you can access information. That website we'll put in the chat box now. It is www.health.gov.au. All of what we are presenting today is sourced from that website. For personal health advice about any condition you have or the potential interaction with the vaccine, you should see your GP. The information today is accurate as of March the 23rd, so as of today. So if you are watching it at a later time because it is being recorded, that advice may have changed. So we encourage you to always check health.gov.au for the latest advice. Thank you so much for calling in today to this important webinar. My name is Natalie Lang and I'm the Branch Secretary of the Australian Services Union. I'm joined today by Angus McFarland, our Assistant Secretary. Do you want to say hello, Angus?
Hi everyone, it's great to be here today. I'm in our Redfern office and I acknowledge that I'm on Gadigal land and pay respects to elders past and present.
You, Angus. It's going to be a conversational format today. So I'll be putting to Angus really what are the biggest themes of questions that we've been receiving from members over the last couple of months, and in particular in the last week when we asked you to send those questions in. So Angus, if we can kick off, can you remind us what vaccines are approved for use in Australia and how were they approved?
Great, thanks Natalie. So at the moment, there are two vaccines that are approved for use in Australia. So they are the Pfizer vaccine, of which Australia has purchased 20 million doses, and they are arriving steadily from overseas and they will arrive throughout the course of the year. And we know that they are particularly being used in phase 1A. The other vaccine that has been approved is the Oxford Astrozenica vaccine. Australia has purchased 50 million doses of that. Some of those have come from overseas, but they are also mainly going to be produced here in Australia, which is fantastic. So we have our own supply here, and the locally produced ones will be coming online soon. They're the only two that have been approved for use. There is another one we have purchased called Novavax, and it's currently going through the approval processes. But at the moment, we definitely have enough vaccines for everyone that wants a vaccine. And the way they are approved is by the Therapeutics Goods Administration, and that is the same approval process that is through any other drug or procedure in our health system in Australia. It's important to note there was no rushing of the process here in Australia. We followed exactly the same process that any other medication that any member watching this might use was approved through. And if you're interested to find out more about the approval process and how it worked, the TGA website has got really great information about that. So it's tga.gov.au. And basically once it's approved by the TGA, it then goes to a committee of health experts who then talk about who should or shouldn't take the vaccine if there are particular precautions. And at the moment, they're advising that it is not used for young people, and that's at the end, they're at the end of the queue, and also for pregnant women as well. But if you have concerns though about that, and we'll get to that later as well, you should talk to your GP.
Thanks, Angus. I almost had that moment of being on mute and needing the hands to be waved and say you're on mute, but I think we've got through that okay. Angus, we know that the disability sector workforce are covered in category 1A and 1B as priority workers to be able to access the vaccine. Can you tell us a bit about what's the difference between category 1A and 1B and how will members know which category they fall into?
Yes. Now, I just noticed a comment that my sound is not is echoing. So I'm going to try to put headphones on and see if that fixes it, because I don't want people to not be able to hear me. Ooh. Can you hear me there, Natalie? Is that better? Hopefully that is clearer for everyone as well on the line. Apologies if there was an echo. The air conditioning can be a bit strong sometimes here. So in terms of who is in 1A versus who is in 1B, the government has developed a national rollout strategy, which is based on advice from health officials about who should be a priority population to get the vaccine. And it's based on people who might either get severe COVID, if they were to get COVID, or people who live or work in areas where COVID could spread quickly if they got it. So based on that, the advice from our health experts of the government is that there is phase 1A, which includes aged care and disability care staff and aged care and disability care residents. Now, what that is specifically referring to, though, is people in residential services, so clients and workers in residential. And what is the definition of residential? The residential is at least 2 or more clients in a house. So if there is basically 2 or more in a residential service, supported independent living, or a group home, then the customers or the clients, as well as the support workers, are in 1A. Now, 1B is a broader category of anyone with certain medical conditions, which could include people with disability if they have certain medical conditions. And it also includes the broader disability sector workforce where there is a client-facing role. So pretty much our understanding is if you work directly with people with a disability in your role, then you are either in 1A because you work in a group home or supported independent living, or you're in 1B because you work in, say, individual supports or in day programs, or you're an advocate that works with people with disability, roles like that.
Okay, thanks, Angus. So if you are in category 1A, how will you access the vaccine? And is that different to category 1B? Can you talk us through how that's going to work? Because I understand 1A has already commenced and 1B is online now. So how do you access the vaccine and how does that differ?
Thanks, Natalie. The way that you will access the vaccine is a bit different. So I'm going to start by talking about 1A. So 1A are workers in group homes or supported independent living, residential services with 2 or more clients. So if you're in 1A, this is how it will work for you. The government has contracted some private nursing companies who will be going to every single residential service or home of people with disability and will provide the vaccine to the person with disability in their home, and that any worker that is on shift that day can also get the vaccine at that time. So this is going to take a while to happen. So even though we know it's 1A and meant to be the first priority, the logistics of sending out teams of immunisers and nurses to every single group home in Australia is going to take some time. What we know they are up to right now is they are about to start calling every service to book in the days that they're coming. So we know that this week and next week, they will start to make those calls. They have been, you might think, what's been going on? Because didn't it start a month ago? They were trialling it in Canberra in particular. So they worked with a few providers of group homes in Canberra just to check how it would work, what they needed to, work piloted a bit, I guess, to see before they expanded it to everyone. So that's essentially how 1A will work. And if you're a worker in a supported independent living service with 2 or more clients, then you can either get the vaccine on the day the vaccinators come to visit your site, and your employer should be telling you those days and times. Secondly, your employer might work with the private nursing companies to set up alternative arrangements for workers, like coming into one of your hub or central offices for a day just for workers in that service. So that might be the second option. Or thirdly, if you can't, for whatever reason, come to one of the arranged and scheduled vaccination days that your employer is organising, you can now just go to your GP as a part of 1B and actually just in your own time get the vaccine there by showing that you're in 1A. So 3 ways you can get it if you're in supported accommodation. On the day your clients get it, on another day that your organisation rosters for workers to get it together, or you can now just go to your GP as a part of 1B.
Angus, before we move on to 1B, there's just been a question in the chat box, which is just really a point of clarification around the 1A. So can all workers of that site, including staff working on the day of the vaccination, get the vaccine when those nursing companies are on site administering?
Yeah, so that is something that really we need to talk to your provider about, because apparently what they are doing is they are wanting to speak to every provider about what works best for them, and right down to a house level. And every provider is meant to have already nominated a lead contact for each house, Now, it might be, could be the CEO, more realistically, probably might be the team leader, or it might be someone like an area manager. So you need to know who is the lead contact for the house you work in, and that person is liaising with the immunisers around the staff that work there, the customers that work there, or clients that work there, who will be there on the day. So when they come, they have enough vaccines for people that are there, and they have the right amount, so there's not wastage as well. There's a lot of storage around these kinds of things. So I would expect that employers who want to encourage their staff to be getting the vaccine, and I know all of them do, should be giving you as many options as possible to attend one of those days that the vaccinators are coming to your site. And as I also said earlier, I have heard that some employers are wanting to propose that they organise special days at a hub office or a regional office for their staff in 1A to get the vaccine. And the health department, I've seen them say that they're happy to talk with each provider about those arrangements. They want to do what works for particular providers. And we know providers are big and small and have different geographic areas, and some things will work for others and some things won't. And that's a good thing, because we have advocated, and this is from members back in January, for it to be as flexible as possible, to not have a one-size-fits-all, and to have as many opportunities as possible for workers to get the vaccine if they want the vaccine.
Thank you, Angus.
In terms of 1B and how it will work in 1B. So for 1B, so that's if you don't work in group homes or supported independent living, you can now actually go to any of the vaccine clinics that have started this week to get your vaccine. You just will need to demonstrate that you work in disability services. And it's either by filling out a declaration form or taking a letter from your employer that says, you know, with me, it would be like, Angus McFarlane is a disability support worker at our service, with a letterhead and a contact of someone. And once you've got that, you can then book in and go and get it done at your GP. Now, remember though, in 1B, there are 6 million people in 1B category. It's not just disability workers, it's a whole range of people. So again, it might take time to book in your vaccine for 1B. But if you're in 1B and you do want to get the vaccine, we'll show you right now, actually, we might do it now. There's a tool the government has launched to help people find out if they can get the vaccine, and then how they and where they get it. It's an eligibility checker. I'm going to share it with everyone on the screen, and we'll send the link around as well. So I'll just share my screen.
Fantastic, Angus. And just while you're bringing up the screen to share, we do have a few questions that have come through, in particular about whether sole traders still count as disability support workers for the purposes of accessing the vaccine if they're not employees of an organisation. So I'm sure that's what we'll be able to work out as everybody's able to refer to this fantastic resource that you're taking us through.
And the short answer is yes for 1B. You would just have to make a declaration that that's what you do. Like, you know, and obviously people, and that would be enough, is my understanding. Or if you have a company as a sole trade, you've got information around, you know, letterhead or whatever that can link to the business you have, that's good as well. But yes, anyone who has a direct client-facing role in disability services, our understanding and advice is that they would be in 1B. So how do you find out though? So I hope everyone can see this vaccine eligibility checker, and this is the government website. So let's pretend that we'll do it for me, and I'm going to say that I'm a disability support worker here in Redfern, and I support people with essential work in the community. So let's start. So here we go. Well, revealing my age, I'm 35 years old. What state am I in? I'm in New South Wales. Do I work in one of these industries? No, I don't work in quarantine. No, I'm not a frontline healthcare worker. And for these purposes, I'm not residential because I work one-on-one supports in the community. So we know that means I'm not 1A. Am I a resident of a disability or aged care? No. Do I work in one of these industries? Defence, police, fire, emergency, meat? No, not those either. Aha. Do I work in the healthcare industry? Now, I know we wouldn't normally consider disability the healthcare industry, and we actually have told the health department it's a bit misleading, and they've committed to actually fixing this at some point. But if you hover over the question mark, this pops up, and you'll see that it says that anyone who is an essential carer of someone with a disability, paid or unpaid, basically is a part of 1B. So I say, yes, I am. Aha, it then tells me that based on the information, I am eligible to book a vaccination because I'm in 1B. And I can get it at general practices or GP-led respiratory clinics or Aboriginal controlled community health services. Then it also says to bring up my Medicare card if I've had one, and the eligibility might be checked again when I arrive. So that's why it's important to have that proof that I work in the sector. And then what's great about this is I can click and make a booking right now. So I'm in Redfern, so I'll put in my postcode, Redfern, search. And then if you look here, I don't know if you can see this, Natalie, can you see it coming up? I'm zooming in on Redfern. Yep. You can see right now in Redfern, these are the places that I could get booked in for a vaccine. Now, Redfern Medical Centre, I know that I've been there before actually, so click on that. And here, and then I can literally pick up the phone, make a call and make a booking. So that is a really useful tool that the government has launched to find out whether or not you're eligible, and if you are, to actually find out where you can book in right now in your community to get the vaccine. And then you can go ahead and do that.
Great, thanks Angus. Has the vaccine been made mandatory for disability workers, and can your employer make it mandatory?
Well, this is probably the question we have had the most coming from members in advance of today's meeting. So I want to, make sure that we can cover this properly, and if there are things that people still want to ask, put it in the chat box, put it in the Q&A, because I understand this is one that people are really have a lot of concerns about or confusion about. So I think the first thing to say is that the COVID-19 vaccine is not mandatory in the disability sector. So the government has said that it as the government, will not be forcing anyone to have the vaccine. So the government is not going to do that. So I guess the question is, well, if the government doesn't make it mandatory though, can my employer make it mandatory? What this comes down to is sort of a concept as known as what is essentially reasonable or a reasonable direction of an employer. Employers can give directions as long as they are reasonable and lawful. And in this situation, it would mean considering things like the health advice of government, which currently says it shouldn't be mandatory, the practicality of actually enforcing it. So when we know that it's going to take months to roll out, like how and when could you actually enforce something like this? Advice from Safe Work Australia and safety regulators. Safe Work Australia, for example, has said it does not need to be mandatory in disability services. What reasonable exemptions there would be based on health advice, other controls that could be put in place, what level of risk is there for workers or clients, and it has to involve consultation with union members. So I think that if we are trying to get as many people to have the vaccine, and I know that that's something that I think most people do share, that we do want this rollout to be successful, then do we take a carrot or a stick approach? I think it's important that in something like this, people can make informed choices and people can go on a journey and in terms of if they're not sure about it, getting information, talking to their GP, looking at the health website and getting more information so they're happy to have the vaccine, and that therefore people should not be forced to get it. So essentially, our intelligence is that most employers in the disability sector are not making it mandatory. And instead they are working with their union members and staff to talk about questions or concerns that people might have about the vaccine and giving information to people to help them make an informed decision. As I said before, Safe Work Australia the regulator of safety law in Australia, has said that it is not necessary to make the vaccine mandatory in disability services. And again, because one, it would be impractical to force that. And secondly, because there's still, the vaccines we know are extremely effective at stopping you from getting ill or dying of COVID, the person that gets the vaccine. So me taking the vaccine will certainly support me and stop me from dying of COVID. But there isn't a lot of data yet onto whether it will stop transmission. And that kind of undermines an argument for it to be mandatory, because even if someone had the vaccine, I potentially could still get COVID and pass it on to you, Natalie, just that I wouldn't die or be sick from it. So that's another reason to undermine it, it being mandatory. And the other thing is that employers are covered by anti-discrimination law, and that protects people from being terminated, for example, on the basis of their pregnancy status, on the basis of a medical condition, on the basis of a disability, or on the basis of a religious belief. So making it mandatory might also be a breach of discrimination law for some employees. So I guess my advice to members is, if your employer is talking about making it mandatory, do contact the union. Any safety measure at work, actually you have the right to be consulted, and as union members be consulted. And that's really important to remember throughout this.
Thanks, Angus. Do we know which vaccine is being made available to Category 1A, whether it's Pfizer, AstraZeneca or both?
So what we do know is that Pfizer is definitely focused on 1A, but people in 1A may also have AstraZeneca. It depends on where they are, the location, the date and time, because Pfizer is, just like AstraZeneca, the supply is coming in steadily, week by week, month by month. Just because Pfizer was approved first, it doesn't mean that we have all of the Pfizer doses sitting here ready to be delivered. So it could be one of either in terms of 1A. I understand it will be AstraZeneca if you're going to a GP. But what is also important to note is that I'm pretty sure that the government has actually banned any vaccinator from sort of promoting one over the other, or saying, come to me to get this or come to me to get that, because they both save lives and they both are very effective. And so I know that the government and the health department are trying to say that, look, it really doesn't matter which one you get. They both have been approved. They are both effective. And so I don't think there's a lot of information necessarily about which one at certain sites or clinics, because they don't want it to be this thing of people trying to get one or the other, because they're both very effective.
And do we know yet if it's expected that this will become an annual vaccine like the flu jab?
Yes, we don't know yet whether or not that will be effective. That will be the case. We know that there are different variants that are emerging, and we know that different companies are looking at trialling boosters and things like that. So there is a possibility that it might become something that is annual, but we don't have enough information yet. And I imagine our wonderful chief medical officers across the country will be letting us know about that during the rollout. But the priority at the moment is just to get everyone who wants this vaccine to get this one.
And I understand that the vaccine's administered by 2 jabs with a period of time in between the 2 jabs. Is it necessary to have the same vaccination for the second jab as you did for the first? So if your first jab was Pfizer, do you have to have Pfizer for the second? If your first jab was AstraZeneca, do you have to have AstraZeneca as the second?
Yes, this is incredibly important, because otherwise the vaccines won't be effective. You need to have 2 for each of them, and it has to be the same one. And how that will be done, I understand, is that when you get your first jab, you will be booked in for your second. So that will actually be arranged before you leave your first one. You will know the date, time, and location of when you're getting your second one. And it's also important because there are different periods between the 2 of them. So, for example, I'll just check my notes. With Pfizer, there needs to be a 3-week gap between jab 1 and jab 2, whereas AstraZeneca, it can be from 4 to 12 weeks. And the other way the government will make sure that this happens well, and there are hopefully any mistakes on this, is that everything will be recorded in the Australian Immunisation Register. So when you get your first jab, already exists a government health database. It will be noted. Angus Farland got Pfizer on this day, this location. My next booking is this day, this location. So if for whatever reason I missed that second one, and I rock up to my GP that has AstraZeneca, for example, they'll see, oh, no, you've had a Pfizer one, you need to get the second Pfizer one. So there's a system there, I guess, to check that as well.
I think that system response leads us to another question which we've received, which is, will you get evidence from having had the vaccination? So once you've received the vaccine, that you could then use for other things down the track, such as travel or flights if needed, or proof?
Yes. So my understanding is yes, on the day of the vaccine, you will get I think you're going to get both an email, if you would like, and a written documentation from the GP or the immuniser saying that you have been vaccinated. I assume you get it at the second appointment, not the first one, because you need the 2 for it to be effective. Yeah.
There's a couple of questions here, which I'll try to just put into one question,
yep.
which is around that point you were talking to around the evidence of being a worker in the disability sector to fall into either category 1A or 1B. Essentially, can your company ID card be considered sufficient evidence of working in the disability sector? Or if you need a letter from your employer, do you need to go and ask your employer to provide you that letter? What would be the recommendation around how it is that we get our employers to provide that evidence?
That's a really good question. So I think that the important thing is that the proof of that will need to be given on the day that you are getting the vaccine. So that's the first thing, because I know some people, you don't have to have that before you get, you make a booking, because if you try to book now, it might be a month before you can get in. So it doesn't mean to stop you from making a booking, but on the day you show up, you will need something. What the health department had said, and I was in a meeting of the health department and disability employers were all in it too, and they asked a lot about this, and this was about a week ago. And what they said was that essentially you can do a self-declaration, and there are forms on the health website that you can fill out, like a stat dec type thing, where you're saying, look, I hereby declare that I do, and it's a truthful statement. They also are going to be sample letters that they put out as well from employers, and employers, hopefully should be able to do this quite easily and provide this to all of their workers. I think potentially a staff ID card may be effective if it's very clear that that it's a disability organisation you work for. If it says your job title is a disability support worker, potentially that could work. But I think getting a letter from your employer is the best thing to make it clear.
Another question, just quickly before we move on to a discussion about supporting people with disability to access the vaccine. The fact that there's 2 different vaccines, does the worker get to choose which vaccine they access?
So my understanding, no. It's based on the vaccine that will be coming so hold on a second. Category 1A, if you're in a supported independent living or group home, and there is a vaccine that is coming to your workplace to vaccinate your clients, and you're going to get vaccinated at that day, they will bring what they bring. It could be Pfizer in 1A. We do know it's not a Pfizer, but it might not be. It could be AstraZeneca. My understanding, again, I'm pretty sure that the providers aren't allowed to be advertising or talking about which vaccine they have. That's what I was told in a health department forum like this a week or so ago. If you're in category 1B, I don't believe that GP clinics will have Pfizer because it has to be stored at such cold temperatures, but and there are currently very limited big major hospitals that provide Pfizer vaccine. So I would assume it would be AstraZeneca and GP. But the really important thing to note is that they're both extremely safe. They both save lives. They both have been approved by the TGA. So I think that's the important thing to remember.
Another question is about the issue of proof of having received the vaccine. Are you required to have proof of having received the vaccine, and how does that relate to a worker's right to some privacy?
Yeah. So I guess in terms of privacy, it's about how the information is stored and who has the information. And in terms of the getting the proof, you will get, when you get the vaccine, you will get that information directly sent to you and given to you in hard copy. So what you do with that, if you want to give a copy of that to your employer or for them to keep on file or your client or whatever, you can do that. You just need to be careful around making sure they've got good privacy policies around how they store that information and how they use that information. But you certainly will get proof. That will be from the government, like from the health or your doctor, whoever gives you the vaccine. After the second one, you will get a record that you can then use and you can show and give to who you want to. It's your information, it's your health information. Yeah.
Great, thanks Angus. Now, just for everybody who's participating in today's webinar, thank you for sending through your questions. If I can remind you to please use the Q&A function, which is down the bottom of the screen, to put your questions into. I am trying to get through all or as many as possible of those questions, but I'm trying to do it in a thematic way. So my apologies if you've asked an earlier question. I'm hoping that we'll be able to put that as we move on to the next theme. But while we're still on workers' access to the vaccine, can I ask Angus, with regard to client-facing, so this description of a client-facing disability sector worker being in category 1A or 1B, does client-facing extend to other areas of work which may be office-based but still have time-to-time contact with NDIS participants, such as support coordinators or local area coordinators?
Yes, so this was a question that was raised in another forum I was in directly to the health department, and the response that was given, it was basically, if you as a part of your job need to be meeting with and interacting with and supporting a person with disability, then that would be included in 1B. And the example given was like a support coordinator or an advocate. So I believe, yes, you would be in 1B for roles like that.
We have a few questions about assisting NDIS participants to access the vaccine. So we'll move on to that theme. I do know that there are other questions about worker access, and we will be able to come back to those throughout the course of this webinar. But moving over to the role of our members in supporting NDIS participants to access the vaccine. Can you tell us a little bit about how it will roll out for NDIS participants, and how do ASU members help NDIS participants, assist NDIS participants to get the vaccine if they want it?
Yeah, definitely. So much like for disability workers, for people with disability support workers, for people with a disability, at the moment there are two ways that they could be receiving the vaccine. Either they're in category 1A because they live in a supported independent living or group home with one or more other people. So that would mean they're in 1A, and that means they will be getting the vaccine if they would like it in their home on a scheduled day. But if they're not in 1A, then that eligibility checker tool does include in 1B anyone with certain medical conditions, and it includes significant disability requiring frequent assistance with daily living. It specifies Down syndrome, muscular dystrophy, brain and spinal cord injury, and severe intellectual disability. And it also includes severe mental health conditions like schizophrenia and bipolar. So if using the eligibility checker, the person with disability has some of those medical conditions, and there's a much longer list, then they are in 1B. And just like workers in 1B, they can go to a vaccine clinic or a GP, make a booking online and go and get the vaccine. The last thing I will say though, as to on the different ways they can get it, anyone under 18 though is not recommended to get the vaccine, and that includes people with a disability under 18. They're at the back of the queue at the moment, whether or not they have a disability. In terms of supporting members to get the vaccine, obviously it's really important that every Australian, whether you have a disability or not, has consent, and informed consent over any medical procedure. And we've raised this very early on, back in January with the government, about wanting to make sure there are clear resources and guidelines to support our members to help people with disability making their own informed choices. Because it's certainly not mandatory for them to have it either. It should be everyone's own choice. So to do that, the government has now produced consent forms as tools to use in obtaining consent. Now, they don't have to be used the exact forms, but there will need to be a record of consent given, and that the government, the vaccinator, the nurse, will want to take. And ideally, they want a written, some written proof of that. So I think we can put in the chat now the link to the actual model consent form. And I guess in navigating that, we look at if the person with disability you support usually would get assistance from a guardian to consent to other medical procedures, then it's the same process. So what is the process whereby if someone that you support has to go to the doctor, has to have a procedure, how are they making decisions around that? Who's informing them? Where are they getting support? If there are issues around guardianship and other people providing consent, however it works in other medical procedures, it should be the same for this one. And there's also been specific guidelines for workers and providers in obtaining consent and the processes around that. And I think we can put those in the chat as well. It's another little fact sheet and resources. The resources about the vaccine are also available in accessible formats, in easy read English, in Auslan, and in multiple languages. And they are all available on the health.gov.au website. There's a whole page dedicated for people with disability to find out about the vaccine, and in particular information on informed consent. So these discussions do need to happen certainly prior to the vaccination. So in accommodation services, they really should be happening now. And I think providers, employers should be giving our members all of the information to support people with disability in making their own informed choices. And if medical assistance is required in terms of getting advice from a doctor, or if you need to involve a guardian, for example, those conversations need to probably happen as soon as possible to start that the ball rolling, and so the person can give their genuine consent if they would like to have the vaccine. And the other thing I will just say, sorry, is, and I know our members would know this, but it's important, any procedure that is without the consent of a person with disability would be a breach of the NDIS Code of Conduct. And that would be quite a big penalty and risk on the organisation and potentially the workers involved if it was found that people were deliberately did not have their consent honoured. And so it's really important that conversations are happening now, and that we're talking at work about how we can support people with disability to make informed choices about their body and their health and their medical procedures.
I've got a few more questions that have been coming through in the various chat and Q&A functions, and also emailed in before today. So if I can work through those. Firstly, we've had a member who's done the check. They're in category 1A, but they've not yet heard anything from their employer about access to the vaccine. So what do they do?
Yes, this is quite common concern that members have raised, and it's just because, I guess, the nature of the rollout and the fact that because they want to come to individuals' homes to vaccinate them in 1A, and because the disability sector, unlike aged care residential, which are bigger facilities with hundreds of people in them, in disability, they're people, homes in the community with 2, 3 or 4 people in them. There are so many sites to visit that it is going to be, I predict, a while to get to every site. And they've been testing it in the ACT and Canberra for the last month. And as I said, now they are starting to contact every service provider and book in the days that they're going to come to your group home. So that will happen over the coming fortnight. Not that they come, but that they make the booking. So you should know in the next 2 weeks when they'll be coming to you.
Thanks, Angus. Now, for everybody who's on the webinar, we do only have 13 minutes left for the webinar, and I do have quite a few more questions to get through, so we'll do our best to get through all of them. If you are in category 1A or 1B and you're not quite sure if you want to get the vaccine, is it do it right now or you'll miss the boat, or do you have an opportunity to think about it and change your mind?
Definitely can get it later if you are unsure and want more information. You do not have to get it the day that they come to your group home, if that's where you work, or supported living, independent living. You definitely can get it later.
Okay. And should I be taking the flu vaccine at the same time?
So the flu vaccine is encouraged to have, like it is every year. It's an important health measure against the latest influenza. But the important thing to note is that the health advisors of the government have said that there should always be at least 14 days between any vaccine injection, just to monitor for side effects, and so they know, what might have caused something if you do get unwell. So if you're going to do the flu vaccine, you need to make sure it's a full 14 days outside the 2 COVID jabs.
So not in between? On either side?
I think technically it could be in between, as long as it's 14 days and 14 days, which wouldn't work for Pfizer because it's got to be within 3 weeks. It could potentially work in Astrozeneca because it could be up to 12 weeks. You could have 1 and then 2 weeks and then 2 weeks and then the other. So you could do it with AstraZeneca, you couldn't do it with Pfizer. So you just really have to be careful that it's a clear 14 days after between each jab.
Okay, now I'm going to give you a omnibus question, which brings together a number of questions from members. It's on the issue of mandatory or not mandatory, and thank you, Angus, for the way that you walked us through why it is not mandatory and all the reasons why an employer should not make it mandatory. That being said, we have some remaining questions. First off, can people with disabilities say that they only want to be supported by somebody who is vaccinated? Can your employer stand you down if you are not vaccinated, or can your employer dismiss you if you are not vaccinated?
Okay. So in terms of can people with a disability say that they want to be supported by someone who is vaccinated? So I guess the principle here is a very clear one that the NDIS has said, and the NDIS Commission, which is that people with disability do have choice and control over the people who support them. So theoretically and like practically as well, yes, that they can say that. I guess there are some things though that in terms of practically when someone could say that, like at the moment, hardly any support workers in the country are vaccinated. So it might not be reasonable or fair to sort of demand that now, but because it might be the case that no one's been able to have the vaccine who supports them. But certainly if the workers who support them have had the opportunity to get the vaccine and have chosen not to get the vaccine for whatever reason, then a person with disability can say that they would like to be supported by someone else, and that is their right under the NDIS. And there would need to then be conversations at a workplace level though about that, and talking it through like you would with anyone else about who they support. They might change their mind. They might decide that they want to stick with the support worker that they have, or they might say, no, I really like someone that is immunised, and then they you have discussions about who that is, and then what that would mean for maybe changing people's hours or the clients they work with, or the shifts or the services, etc. So it's just about having a conversation about those kinds of things. Right now, people with disability have the right to have a choice over their supports and how they're done, and as they should, and that will include things like this. So it is something that, yes, they can. But on the question of can an employer then, or separately just stand you down because you haven't got the vaccine, you've chosen not to, I think that would be very unwise. So we've already spoken about how it comes down to what's a reasonable direction, and when the Safe Work Australia has said that there's no need to make it mandatory in the disability sector, when actually making it mandatory doesn't necessarily even stop transmission. And also when we have anti-discrimination laws that protect people from being stood down or terminated for pregnancy or religious belief or medical conditions, I think that that would be very unwise. And if that happened to you, contact the union, because it would be in a strong position to argue that that was not a fair dismissal.
Thanks, Angus. Now, I know that there's some remaining questions. A lot of the questions that are coming up now are a bit nuanced on some of the information that was provided earlier in the webinar. And I understand, everybody, it is a huge amount of information to take in. We are recording this webinar and we will be making it available to everybody who's registered for today. So the fact that you're all here means that you are registered, so you will get access to this webinar. So if you do have any outstanding questions at the end of the webinar, I'd encourage you to go back and re-watch the webinar, because you may find, based on some of the questions that are still coming through, that some of those questions have been answered in the discussion earlier in the webinar. If you do have any outstanding questions at the end of that, please do not hesitate to contact the ASU. You can do that by emailing help@asu.org.au or calling us on 0293104000. Finally, Angus, I'm in category 1A. What's going to happen on the day? What do I need to have with me? How's it going to look? And you've got 1 minute.
Okay, I'll be really quick. So on 1A, if you are in a residential service, your provider would already have been sent a checklist for all of the things that need to be ready for that day. And hopefully you would have seen it, but we are going to share it with you all now in the chat box. It's got things like you need to have separate spaces for people to get the vaccine, separate spaces for people to be, observed for 15 minutes after the vaccine. There also needs to be information to all of the workers around common side effects that might happen to look out for and how you report them. There's a special process around contacting your lead contact for your service, and they have to contact the health department if any side effects adverse side effects happen. So there is a whole checklist there that your provider should already have had for several weeks. And so hopefully they are talking to you about that and getting ready for your vaccination day at your service.
Okay. Is there any insurance cover if somebody is to fall sick from receiving the vaccine?
My understanding is that it is covered by the government. If you fall sick because of a side effect, which I should say is extremely rare that anyone has serious side effects, then as a worker you would be accessing, I guess, your personal leave in that situation. In terms of whether or not it falls under workers' compensation or something like that, I'm not sure of the answer of that right now. My last understanding was that they were seeking advice on it, and because it's not mandatory and it's a voluntary thing that you're choosing to do, I don't know if it would be under that. But I think the important thing to note is that there have been hardly any serious side effects reported anywhere in the world to these vaccines.
Both vaccines that are currently available in Australia, as you were saying, Angus, have been through a very rigorous process of approvals. And so that information is discussed further on that health website that we referred you to at the beginning of the webinar. So if you go to www.health.gov.au, you can access further information about exactly what approval process those vaccines have gone through in Australia. We are very fortunate in Australia that, unlike other countries around the world, we did not need to go through an emergency approval process that you may have heard about in the media. The COVID vaccines that are available in Australia have been through exactly the same process as any other medication that is readily available in Australia. But do go to www.health.gov.au so that you can feel satisfied about what process has been undertaken and get the best information. Angus, I want to thank you so much today for your time and your expertise. We really appreciate it. I think we've been able to get through most of the questions that have been coming in prior to today and also on the day in both the chat, the Q&A and email functions. I want to thank all of our members for the incredible and important work that you do. You need to make sure that you are safe and that your well-being is looked after, just as you do about the people that you support, NDIS participants and our community. We hope that today's webinar has been helpful for you. If you do have any outstanding questions, please feel free to contact the ASU. But always remember to follow the health advice, including speaking to your GP about any individual questions around your own personal health situation or any medical conditions that you may have, and make sure that you use trusted official sources only for sources of your information, such as www.health.gov.au. Remember, we have shared in the chat box that you can use the eligibility checker to find out if you are eligible for category 1A or 1B, and also to find the locations of where you can make a booking to access the vaccine. We've shared the link in the chat box for those, but they are at covid-vaccine.healthdirect.gov.au/eligibility. And again, I'll refer you to the chat box with that link. There are legal consultation obligations on your employers. So if they want to implement policies about the vaccine and the rollout for their workers and their clients, the work health and safety laws have consultation requirements that your employer is bound by. So it's really important that if you are concerned around how the vaccine is going to be implemented at your organisation, how it may impact on your work or your access to the vaccine, then now is the time to be having those conversations in your workplace. The ASU can assist you to have those consultation discussions with your employer. Again, email the ASU at help@asu.org.au, call us on 0293 104 000, or contact your organiser if you have their direct contact details. And we are passionate about making sure that you are supported to have a say in your workplace about all matters that impact on you, your career, your health and safety, and your clients. So please do contact the ASU. Remember, your employer does have an obligation to consult. This is a big milestone, the vaccine rollout. We have had a huge year, more than 12 months since COVID hit our shores. I know that during that time, ASU members have worked through the most challenging of circumstances. When so many areas in our country shut down, ASU members working in the disability sector stepped up and kept our services running, kept our communities safe, and ensured that people with disability had fantastic quality service delivery right through the global health pandemic. Thank you for your work that you have been doing, not just over the last 12 months, but all the time in the community and disability services sector. This is a big milestone for us now, access to the COVID vaccine. Please make sure that you are accessing information so that you're able to make an informed decision about accessing the vaccine to keep yourself, your clients and your community safe. We will continue to keep you informed and be by your side every step of the way throughout this process. You can contact us if you have any further questions, help@asu.org.au, or call us on 0293 104 000. Again, thank you every single one of you as a ASU member working in the disability sector. You are the heroes of the pandemic, and right now we couldn't be more proud to be by your side as we approach this milestone of accessing the COVID vaccine. So thanks everybody, and stay safe.